Good afternoon, folks. Thanks for joining us today. I am Robin Colonel, and I will be your host. We have all the lines muted today. If you have any questions, we highly encourage you to use our Q&A option. You should find that in the lower right-hand corner of your screen. I'll be joined by a couple of my colleagues I'll introduce here just in a minute, and hopefully we will keep this presentation to less than an hour. The information that we provide today is for general information purposes only. The information is provided by UK Healthcare's Kentucky Regional Extension Center, and while we endeavor to keep the information up to date and correct, we make no representations or warranties of any kind, express or implied, about the completeness, accuracy, reliability, suitability, or availability with respect to content. So joining me today is Kelly Fountain. She is our Practice Transformation Manager. And then again is Jessica Elliott, and then myself, Robin Colonel. We are all Quality Improvement Advisors with the Kentucky Regional Extension Center, and we are very excited to be able to present to you today information regarding this program year 2022 for the Quality Payment Program's final rule. Additionally, you'll see in our list of panelists some of our other colleagues, additional quality improvement advisors. You may recognize some of their names because they serve on multiple service lines. And so when we get to the Q&A portion, because we have multiple subject matter experts, they may additionally answer some questions along with the three of us. So again, thank you for joining us. Our agenda today, we'll talk about MIPS updates. We will talk about updates in regards to the alternative payment model program, and we'll wrap up with the MVP update. So we've been waiting on these MIPS value pathways for a while. CMS has been pushing them back for a couple of years, but they're going to give us some practice time with 2022, so you can elect to participate in an MVP this year if you would like, or you can stay with traditional MIPS. Additionally, we've provided the link to the 2022 final rule here on this same page, and these are live, so you'll be able to access that later after we send the presentation out to attendees. So without further ado, I am going to turn the presentation over to Jessica, and she's going to take us through the next few slides.
All right, good afternoon, everybody, and thank you, Robin. So I'm going to talk with you all just to kind of do a quick overview of the quality payment program, just really focusing on the MIPS track and just really some high-level eligibility and some of those details that were finalized and some changes and updates for 2022. So no big programmatic updates as far as the structure of the particular program. There's still the two main tracks for 2022. You have the MIPS track, which is where you have the opportunity to earn a performance-based payment adjustment based on those services that you provide to your Medicare patient population. And then you have that APM track, and that's that customized payment approach that was developed by CMS, and that is for specific APM designated, CMS designated APMs. And those APMs, they're designed to provide incentive to clinicians who are providing high quality, high value care. And those APMs, they focus on specific clinical conditions, care episodes, or populations of their patients. And with the APM track, you can receive up to a 5% lump sum bonus for participation, whereas in the MIPS track, you can receive up to a 9% positive or negative payment adjustment paid out toward your future claims. No big updates as far as the changes to the actual performance categories themselves. All four of those categories are still in play for 2022. And now looking at eligibility expansion though, we did actually see the program expand a little bit for 2022. So all of the previous clinician types that were eligible for the program have remained for 2022, and we see that some additional clinicians have been brought into the fold, so clinical social workers as well as certified nurse midwives. So we have a few more folks joining into the eligibility for the QPP. Something else to note that is on this slide as well. So historically, physicians have not had an automatic reweight for promoting interoperability to the quality category. And they've also now extended that to that new clinician type of certified nurse midwives. So everyone else, if you are participating in the program at the individual level, you do have an automatic reweight for promoting interoperability to the quality category, with the exception of physicians and certified nurse midwives. So that's just something, again, to keep on your radar. Something else, no adjustments were made to the low volume thresholds as far as determining eligibility. So that still stays at $90,000 in Part B billing, as well as 200 covered professional services, as well as 200 Medicare patients assigned to 200 beneficiaries assigned to your practice within that performance year as far as the thresholds for eligibility. So no changes there. However, we do see some changes as far as thresholds go for the actual thresholds for avoiding penalty for the program. So if you focus your attention to the right-hand side, to the pyramid on the right-hand side of your screen, you're going to see that the threshold to avoid penalty has now increased for 2022. So it's gone from 60 points in 21 now to 75 points to avoid penalty. So anything below 75 points is up for a potential negative payment adjustment, up to a negative 9% adjustment. So anything above 75 points is potential to receive some type of positive payment adjustment. Now, if you're in that gray area of 76 to 88 points, it is really subject to that budget neutrality built into the legislation around the program, where the losers do fund the winners of the program. And so your payment adjustment is based on, that availability of funds. If you look at the exceptional performer category, so that's at the triangle at the top, that has actually increased. So we are now seeing that for 2022, to be eligible to receive the exceptional performer bonus. So remember, that's that pot of money. That's a $500 million pot of money set aside to guarantee that performers that hit at 89 points or above will be guaranteed to receive some type of positive payment adjustment. That is now, again, set at 89 points. So that bar has been set higher, not only to just avoid penalty for the program, but also now to be able to be guaranteed a positive payment adjustment of some type. And also, just as another little caveat, we see a lot of changes with 2022 as we move out of that transitional period of MIPS into the traditional period of MIPS. Some of that flexibility is going away. And so this is actually the last year for the exceptional performer bonus that has been designated and set aside. And just real quickly, just looking at the category weights and thresholds, no changes to promoting interoperability or improvement category weighting. That has stayed the same throughout the program. We have seen, though, that for 2022, quality and cost are now in alignment at 30% each, which is in line with the federal regulation and mandate from MACRA. So moving on to the quality performance category for MIPS. So there have been some significant impacts and updates with this particular final rule related to the quality category. One of the first things I really want to point out and highlight for you all is the removal of some bonus opportunities. And this is going to be potentially impactful to a lot of practices. So if you typically submit your quality data via EHR or through ECQMs, you would be getting end-to-end electronic bonus points. So for every measure that you submit electronically, you can receive, you would receive a bonus point. So if you're sending 6 measures, you're going to receive 6 bonus points. That flexibility, that additional pointage is actually being removed for 2022, as well as receiving additional points for outcome or high priority measures. You're required to submit 1 as a part of your 6 measures. Anything above and beyond that 1 measure, though, has been historically, you would either get 1 to 2 points for per measure. And so practices have been able to take advantage of that scoring to also help further boost their quality performance score. And so that flexibility is going away as well. So we're seeing that, we have forecast that to be pretty impactful to our practices as far as being able to, hit thresholds and to be able to hit that exceptional performer category, because practices really have relied on those bonus points in the past. So definitely want to make sure that you come up with a plan on how to mitigate the loss of those bonuses. However, there is a bright spot. We did see that CMS did retain historical performance benchmarking for 2022. So this is just simply that we know where the thresholds are, what we need to aim and shoot for as far as performance that year. So it's very helpful to have. Also, additionally, web interface. If you do use this collection type, CMS did grant sort of some amnesty, so to speak, and have allowed web interface to continue through to 2022. It was originally supposed to sunset at the end of 21. They have expanded it for an additional year, but it will sunset. This is the last year to submit for web interface. You do have to register for that collection type by June 30th of this year in order to be able to submit that way. They've also maintained data completeness at 70% for 22 and 23. They are considering increasing that in future years. Also, they have expanded an additional public health measure, a claims-based public health measure. So again, there's nothing that you have to do for this particular measure. It's based on the claims that you submit. The new measure that they've added is clinician and clinician group risk standardized hospital admission rates for patients with multiple chronic conditions. So it's looking at patient admission rates for patients that have multiple chronic conditions. And it's going to be applying to group eligible clinicians, group clinicians with at least 16 clinicians tied to a tax ID. And there's an 18 case minimum with that particular public health measure. And that will also be factored into your total quality score, along with any potential other, there's 2 other claims-based, administrative claims-based public health measures that could be applicable that were passed in 21. CMS also did some additional updates around measure classifications and did some more defining of what that looked like. They've also built in some incentives around encouraging providers and practices to utilize and to submit for brand new measures. So brand new, newly created measures for the program, they've been able to provide some additional benefits around scoring if you choose to submit those particular measures. Also, another flexibility that has been maintained is improvement scoring. So if you have submitted data previously for a measure and you submit data again this year and there's been an improvement, you could be eligible to receive up to a 10% bonus per each measure that you do receive, that you do qualify for improvement upon. Also, as always, CMS does update their measure specifications, and they do change that a little bit. So we do always recommend that you go back to your measure specification sheets, you work with your vendor to make sure that your workflows and your documentation is updated and accurately reflected in that. Now, moving on to the promoting interoperability performance category, we did see, again, a couple updates around the objectives for this particular category. So first and foremost, the public health and clinical data exchange objective. So previously, clinicians have had some flexibilities around reporting and meeting this particular objective. However, they're now limiting it to being able to meet this measure. You have to submit through an immunization registry or an electronic case reporting. So you have to have those agreements in place for either of those public health registries. There are some potential exclusions that are available if they're applicable to your practice. I will let you know that KHI is offering electronic case reporting, and there's going to be some information on another slide as well around that. And immunization registry is also available within the state of Kentucky too. So this is something that is a must-pass measure. You must have those signed agreements in place that you are working on that measure to be able to move forward with submitting for promoting interoperability category at all. Also, we see some additions around the addition of attestation to use of SAFER guidelines. So what is SAFER? It's the Safety Assurance Factors for EHR Resilience Guides. And so this is a new required measure for 2022. And so ECs are going to have to attest to conducting what is an annual assessment of the high priority guide of those SAFER guides within the performance year. And so for right now, for 2022, this is going to be simply a yes or no attestation, whether that annual assessment was completed, and either answer for 2022 will allow you to continue with your promoting interoperability attestation. Okay, so it is just going to simply be an attestation statement for 2022. We do anticipate that that will probably change as the years go on, but for right now, it's simply a yes or no, and either answer will allow you to attest for PI. Keep in mind that the SAFER guidelines, while it does sound kind of similar to a security risk analysis, it is different from, and it's actually in addition to, an SRA. So think about the SAFER guidelines as something that might be done internally within your practice, whereas an SRA would be something that is traditionally done by a third party, an outside vendor, to gauge your security and your risk. We also did see some updates around modified language for the prevention of information blocking attestation statement. So when you do your attestation, you're going to see that might look a little different than in previous years. And then also some bonuses. So we did get some flexibility retained around the prescription drug monitoring program. That around the PHE, they did extend that to 10 points, and they're maintaining that at 10 points if you're querying CASPR or a prescription drug monitoring program. Here in the state of Kentucky, it's CASPR. But if you're querying it through like an embedded hot link within your EHR, you can claim that 10 points. And now they've also added an additional 5-point bonus opportunity around public health reporting. So if you already have, agreements or public health registry exchanges in place around, a syndromic surveillance or additional public health registries that you're tied to outside of that immunization or electronic case registry that's required, you can receive up to 5 bonus points. No matter how many you have, you could receive up to 5 bonus points added to your promoting interoperability score. So right there's an additional 15 points that can help bolster your promoting interoperability performance. Now, this next slide is just some information we wanted to make sure that we shared with you all. This is an opportunity that the Kentucky Health Information Exchange is broadcasting and sharing across the state for some additional incentive monies. Now, remember, it's always free to connect from KHI, but sometimes vendors do charge fees to build interfaces with KHI. So this would help to offset some of those vendor fees with connecting to either an electronic laboratory reporting or to do electronic case reporting. And so there's monies that are set aside. The deadline to apply is May 1st for both of these. Just to keep in mind, both of these opportunities are on a first come, first serve basis. And so you want to just make sure that you don't miss out. If this is something that is interesting to you, please go to www.khie.ky.gov to get more details. There's an application process that you'll go through. If you have questions about filling that out, please reach out to us. Please reach out to KHI. We will be more than happy to help you through that particular process, to help you work through that. Something else also just to keep in mind is that there is a deadline by June of 2022 to have proof that you have initiated connectivity or the proceedings for connectivity with building that exchange between your EHR and with KHI. So you do have to get to working pretty quickly on this particular one for funding. So again, just something to keep on your radar, and definitely reach out to us if you have questions or would like some assistance with getting that application filled out. Now on to improvement activities. Not a whole lot of updates with improvement activities. This category stays pretty stable. Again, you still have to have 50% of your eligible clinicians attest or retain documentation of their participation whenever you do a test for your improvement activities if you're submitting at a group level. And as always, they've added some new activities, they've changed some new activities. So go through, take a look at the improvement activities that you typically would submit for. Make sure that they still align with your work and your documentation so that if you do need to make any adjustments, you can go ahead and have an idea of what you need to be collecting during the performance year. And again, remember, it's still just that 90-day continuous time frame at any point in time during 2022 that you can meet that particular measure. And then finally, the cost category. So again, not a whole lot of changes with cost. We've just seen some additional measures. So we have these 5 new additional measures. So that brings us up to a total of 25 cost measures that can be applied to either individual clinicians or to groups, based, on attribution and based upon volume of patients or case minimums, I should say. And so we do see an expansion with our episode-based measures. So there's 3 different types of measures that you can be scored upon. You have total per capita cost, Medicare spending per beneficiary clinician, and then you have these episode-based measures. And the 23 episode-based measures are going to be divided into procedural type measures, chronic care measures, and then acute inpatient type measures. And again, each of those have their own separate attribution methodologies and specific measure specification sheets on how that measure is scored and weighted for that cost category. One other thing I do want to mention while we are kind of talking about cost is the complex patient bonus. So now this is actually added to your final MIPS score after they've tallied up all the categories. But the reason why I want to talk about it here is because they're making some updates to it. So they've solidified that complex patient bonus is actually going to be retained for 10 points. It used to be 5, and then with the PHE, they did increase it to 10 because they recognize the severity of illness that clinicians are experiencing. And so they have decided to revise the methodology for scoring. So now it's going to be based on a couple different criteria. They're going to be looking at medical complexity and social complexity of the patients that you see. And so that's where it's going to be really important to look at how you're coding and documenting for your patients. So that feeds into what's called the hierarchical conditions category score, or HCC score. And so if you hit the median or higher value for at least the HCC score, or depending on the proportion of dually eligible Medicare and Medicaid patients that you see, that's going to make you eligible to receive this complex patient bonus. And so again, how you code, how you're documenting the severity of illness for your patients is going to impact your complex patient bonus. It's also going to impact your cost performance. It's going to impact how patients are attributed to you and how those cost scores are calculated. It's also going to come into play around a lot of your quality improvement measures, especially your administrative claims-based measures as well. So just wanted to make sure we put that on your radar. And also just to keep in mind as well too that if you're used to getting a couple bonus points or for that complex patient bonus, depending on the complexity, both that medical and social complexity of your patient population, you might not be receiving as many points as you have in the past, simply because of how they're changing the calculation of that. And now with that, I'd like to hand the presentation over to Kelly Fountain, who is going to walk us through some APMs as well as MVP updates. Kelly?
Awesome. Thank you, Jessica. All right, so we've covered a lot of information around the changes or impacts based off of the final rule for 2022 to the MIPS track. Let's talk a little bit about the changes or impacts to the APM track, starting first with APPs. Now, just to remind you, in 2021, CMS did roll out and finalize a mandatory pathway for anyone that fell under the MIPS shared savings tracks, in particular, bringing about APPs or APM performance pathways, for short, APPs. CMS made some changes in this last final rule that impacts APPs. A couple of those in particular are going to be impacts on how and what can be reported. When CMS created the APP in particular, they set about a core set of measures. These core set of measures were ultimately intended to be submitted electronically. Now, this is a big shift. So moving away from CMS web interface, which is historically how most APMs have submitted data in the past. Now, ultimately, CMS is pushing everyone that participates in APMs in collecting and submitting electronically data, whether it's actually on the APM track or even on the MIPS track. In this last final rule, CMS gave a little bit more flexibility, and they said, okay, we're going to extend that sunset of the CMS web interface, and they're going to extend it a little bit further for the APP and APM track in particular. So while on the MIPS track it sunsets in 2022, it's going to extend all the way through performance years 2024. So it's going to begin to sunset in 2025 for CMS web interface for the APM pathways. This is good news. This allows APMs in particular to have a little bit more time to get prepared to make that move from web interface as a method of collection and submission across multiple different types of EHRs into a way to electronically collect and submit data. CMS also made a few other changes, in particular around the requirement for submitting 3 electronic ECQMs. Initially, they were planning on requiring that beginning early 2022-23. They've pushed that off, so that's really now looking at 2025. Now, as a refresher, there are different thresholds associated for that APM pathway. Cost is already being factored in because you're participating in an APM. So CMS views it as being unfair to factor in, or essentially they would be doubly weighting your cost if they were to evaluate you on cost again. So cost is carried at 0% weight. Now, promoting interoperability is going to move from 25% to 30% of your overall score. Improvement activities is going to carry 20% of your overall score, and you are going to receive a favorable scoring on this. What that means is that for those APMs that CMS has deemed, so pretty much any APM that is on CMS's list, you're going to at least get 50% credit, and you're going to get increased weighting. So high weighted activity is going to count for 40 points, medium weighted activity is going to count for 20. And then quality is going to carry 50%. So a slightly different weight associated for the APP track. A couple other things came into place. Historically speaking, the threshold or quality performance threshold has been 30% or higher, meaning in order to meet the minimum standard across all of those quality measures, a practice or an ACO had to hit 30% or higher. Initially proposed, CMS had said that they were going to jump up from 30% to 40% in 2022. Due to COVID-19 and various other issues and challenges, CMS is actually going to push that off. And so we don't see that increase in the performance standard to 40th percentile or higher until beginning 2024 program year. So we have a little bit more time. Now, CMS is going ahead and going to roll out the 2 administrative claims data measures, and they're also going ahead and pushing out the kind of push or desire for practices to start participating in or capturing data on those ECQMs or MIPS CQMs when possible. If you're part of an APP or that APP pathway, you should at least be reporting on those 10 core measures or any of those 10 core measures you can report on. And then ultimately, one of the requirements is still going to be that CAPS for MIPS survey. No major changes other than those. Now, MVPs. So we tag MVPs with APMs in particular, because I like to say that MVPs and APPs are very much similar. So they are parallel across the two tracks. MVPs or MIPS value pathways are a menu. Typically, the menu is around either a specialty type. So, for example, one of the 7 finalized MIPS value pathways for 2023 is rheumatology, so it's a specialist. Or it could be a chronic condition. So you may see one for cardiac, or you may see one that's around chronic disease in particular. So it's going to be around specific areas. It's very similar to how an APM may be structured, where it may be around primary care, or it may be around managing end-stage renal disease. It's ultimately managing a specific type of population or a type of encounter. We have a timeline here. So 2023 is the first year now that a practice or an eligible clinician or a multi-specialty group can actually elect to begin participating in an MVP. Now, this is an optional election. You do actually have to register your intent to participate. And registration actually opens the day following attestation closing the year prior. So in order to register your intent to participate in an MVP for 2023, you would actually have to register your intent on April 1st, 2022. So, and there's a couple steps involved in that registration, but we now actually have those details. Now, a couple things to also consider is that you still have to essentially sign up for CAPS for MIPS, and that deadline is going to be June 30th of the current performance period. So you have a couple key dates that you would need to consider. 2026 is the anticipated mandatory date for MVP and APP track participation. So that is the date that you want to mark on your calendars that we anticipate having to move into one of the 2 tracks, whether it's MVPs or APPs, and that's the pathway we're moving towards at this point in time. Now, we will have many notice for proposed rulemaking and final rules in between now and then, so things could change. What we do see is that CMS did finalize 7 MIPS value pathways to be tested and actually participated in 2023. There is this kind of foundation, and the best way to think of it is a menu. So an MVP is a menu in which a practice or an eligible clinician or even an APM can select from. So you would still have to perform or meet their criteria for promoting interoperability, that entire category. So you're not getting out of PI. You would also have to report on at least 1 population health measure, and CMS is going to tell you you're going to select from a menu, a few options, if you will, to pick from. Then you're going to have to report on 4 quality measures that CMS is going to have you select from that MVP, making sure that you have at least 1 outcome measure selected. Next, you're going to select 2 or 1 highly weighted activity for improvement activities. Again, the goal here is still to make sure that you get 40 points. So whatever combination it takes, whether it's 1 high weighted activity or 2 medium weighted activities to get those 40 points and fully satisfy. And then finally, cost. You have to have at least 1 cost measure that's relevant. So again, you would select 1 cost measure from the menu that CMS would provide. So on the right-hand side of the screen, you'll see the 7 that were finalized for 2023. You'll see a various kind of combination here. So you have rheumatology, anesthesiology, emergency medicine, but then you have some that are very specific to disease states, heart disease, and then you have chronic disease management, which very well may cross a wide sphere. So you might have multi-specialties that work together to participate in chronic disease management. A lot of these actually align with some of the specialty measure sets we've seen. So I would look to foresee kind of some of those specialty measure sets we see. We might see some MVPs that align with those in the future. There is a way in which you can actually submit an application to create an MVP. So if you're very excited about this, you might go about setting up your own MVP. Now, a couple other things that we wanted to let everybody know. Initially, QPP Serves Assistance, there was a grant that was set out. It was actually funded through the original macro legislation, so 2015, which said about the Quality Payment Program, which started in 2017. It was funded for 5 years of the program, essentially, and it provided technical assistance for underserved rural small providers. Ultimately, that is how a lot of our webinars have been provided for free across the state of Kentucky and outside of the state of Kentucky. Unfortunately, that grant is coming to an end February 15th of 2022. CMS, their call center will remain active. So we wanted to let you know that. And there you can actually go to their help desk as well. But ultimately, that grant will be coming to an end. We'll still be here to help, but that grant and those services in particular will be coming to a close. Now, another change or another thing that we wanted to let everybody know is sequestration will be resuming. So we did have a pause in sequestration. So there was no adjustment through, or there'll be no adjustment through March 31st, 2022, and then beginning April 1st through June 30th, there'll be a 1% adjustment. Now, beginning July 1st, 2022, you'll see a 2% adjustment. This adjustment will return on your EOBs, and it will be listed the same way as it has been in the past. You'll also see the MIPS adjustment listed there as well. So that unfortunately will be resuming. Now, we always like to kind of come up with the top 10 list. This is actually where we start when we're discussing the final rule after we've kind of sat down, we've digested the whole thing. Areas of concerns, areas of things that we find have potential positive and negative impacts for our practices across the state. So the number one thing, and I think this is something that Jessica really spoke about, was just the removal of end-to-end and outcome high priority bonus points. So while you pair that with the increase in the threshold to avoid penalty, quality carries a large percentage of your category or your performance in this program. Those bonus points for end-to-end and high priority and outcome points, those have such a large weight, or they did, I should say, in the quality performance category. The loss of those is going to make it increasingly more challenging to avoid the penalty. 75 points is already difficult to hit. If you remove 6 points for end-to-end and 2 to 6 points for additional high priority and outcome points, that makes it a little bit more challenging to maximize your points. So just consider that when you're selecting your quality measures. Make sure that you're really staying on top of your quality performance this year, because it has the biggest impact on your overall performance in this program. In addition to that, MIPS value pathway. We have a timeline now. Now we know that CMS is going to change and move those dates quite a few times in between now and when this program becomes mandatory. We know that, but we have an on-ramp. Now it's the time to start thinking about what would fit best for your practice. What is going to fit best for the types of patients you serve? And ultimately, what is going to be the steps necessary to get you from where you currently are to being a high-performing practice in a MIPS value pathway or even in an APP. In addition to that, consider public health requirements for promoting interoperability. The change to the 2 mandatory measures away from selecting from a menu is different. This is something that's going to require you to revisit your participation agreements and addendums with KCI. Make sure you have everything up to date. Make sure that if you're providing immunizations, that everything's squared away. For electronic case reporting, make sure that you have everything signed and dated within the first 60 days of your 90-day reporting timeframe. In addition to that, the introduction to the safer guides for promoting interoperability While it is not a must-pass measure for 2022, this is a new guideline that is very important, and we see it not only for this category in this program, but we also see it for hospital promoting interoperability as well. This is a huge important piece, and it goes along with your security risk analysis. Don't neglect your security risk analysis just because you're now doing the SAFER guides as well. The SAFER guides, from my understanding, takes a little bit of time and energy, so don't wait until the last minute to do those as well. The cost measures, CMS is expanding these cost measures. Considering the fact that CMS has the mission to find and have a relevant cost measure for each and every type of provider out there, so that ultimately there's a quality and a cost measure that can accurately evaluate a type of provider or practice is important. Make sure that you're aware of the new cost measures and which ones will be appropriate or may apply to your practice. Jessica touched on risk scoring for complex patient bonus. That up to 10 points. There's not many bonus points available. So anything you can do to make sure that you're accurately billing and capturing all of the complexities for your patients is really, really important, especially in the new year. Maintaining historical benchmarking. This is something that I know I like to exaggerate sometimes, but I literally did a happy dance when I saw that historical benchmarking was retained. This is something that is really important for knowing how you're performing. Using historical benchmarking against your peers gives you an idea of where you're currently standing and where you need to go to try and maximize your performance. The extension of web interface will give a little bit of breathing room and kind of grace for especially APMs. And then the automatic reweighting for small practices. This is something that's very helpful, especially for promoting interoperability. Some of our small practices across the state of Kentucky are struggling just to deal with the day-to-day demands. I know you all you have a lot on your plate. So the fact that CMS is recognizing that and providing an automatic reweight for promoting interoperability is one of the very nice highlight, if you will. That's why it made it on our top 10. All right, with that, I'm actually going to hand it back over to Robin, and she's going to wrap us up.
Thank you, Kelly and Jessica. So as a reminder, folks, we want you to go ahead and start putting in your Q&A as you think of it in our Q&A in that lower right-hand box. So we want to talk about why you want to be a partner with us at Kentucky REC. And so for some of you who are on today, you are currently some of our clients, and so you get to experience this. But just as a reminder, we help you dive into your data and your documentation. We help you find places where you can make improvements. We find those opportunities, those areas of low-hanging fruit. We look at your performance through a gap analysis, and then we're able to provide customized recommendations for you based on your current status and where you are within your organization and your program. Each client has an advisor assigned to you. They are yours for the duration of the contract. We're available by email most all the time, and then of course by phone, but we are there for you to make sure that you are reaching your potential within the MIPS program. And of course, we're helping you, or our goal is to help you unlock your maximum performance potential. Kelly's mentioned it, Jessica's mentioned it. The thresholds for this program are increasing. The program itself is changing, it's evolving, and has over the last 6 years. And we expect it to continue to do that. The resources that we provide for you, you have exclusive access to content. The webinar we're providing today is open to the public, but for those folks who are partners with us, we offer additional webinars throughout the year, tip sheets, what we call our one-pagers, which are typically a front and a back, but one-pager items so that you've got something quick at your hands to review for categories. And we also help you with attestation prep and support. So you've got us at the elbow, or in the time of COVID, you've got us on a Zoom call so that we're here to help you as you make those submissions. And then hopefully it never happens, but you've got us for audit support. So if you've been our client and we've helped you with attestations, then we're going to help you get with audit support. But prior to that, we're going to provide you with the documentation that you need to retain so that you can defend that audit and be successful. So Kelly mentioned the timeline for QPP. That's where we're also very handy and helpful to have. You know, it's that final rule when they come out, and even the NPRM, I mean, that's 2,000 pages worth of information there, and it's hard to glean through it. And that's why you've got us. So we're able to provide you a review of that. We're able to keep you up to date on your provider eligibility, because we know that CMS does provide those updates, independent if you're in APM track or if you're in the MIPS track. You know, the snapshots are actually a little more frequent than twice a year. The legislative updates, I've already talked about that a little bit, but we're able to glean through that and pull that information out so that you're not spending hours trying to go through that. And then, of course, we can also help you with navigating through some of these special circumstances that we see, or these extreme and uncontrollable circumstances like COVID-19, or if you're in, you know, the folks in our Western Kentucky area that's just experienced these tornadoes. You know, we can help you with your attestation and help you navigate through some of those uncontrollable type events. And then we sit down in the summer with you and we look at your performance feedback. You know, we generally see that late July. We help you navigate those reports. Some do change from where you had your preliminary, so we want to make sure that you notice what's different. We help you understand that final payment adjustment calculation. You know, we talk a lot about the penalties there and what it could be up to that 9%, but we have to keep in mind that that positive adjustment's rarely going to be there. So we're there to kind of help you understand how that adjustment come about, you know, where did that money get funded, and why is it this versus that. And then should you need it, if you feel like your final report wasn't correct or had misinformation there that needs to be resolved, we're going to help you with that targeted review process as well after your feedback report's released. So as you're still putting those questions in, these are our upcoming webinars. You can notice which are open to the public. We've got one in February and March, both that'll be open. The rest of those will be for our client-only webinars. Links will be coming out for you to register for those. And these webinars kind of deep dive into category specifics. So we'll spend a little more time looking just at eligibility, the quality category, PI, and improvement activities, and we'll talk about cost mid-year. So looks like we do have a couple questions coming in. So I'll start with the one, Jessica, I know you're the host, so you can probably see some more that I can't, so feel free to let me know. I have one here that says, regarding quality reporting, public health measures, are they only for groups or are any for individual providers?
That. So the one for this year is sorry, I've got a frog in my throat. Excuse me. The one for this year, the clinician and clinician group hospital admission rates for multiple chronic conditions, that's based on eligible groups. So you have to have at least 16 clinicians tied to your tax ID. Same thing with the HWR. That measure as well is also at the group level. And the name of the third administrative claims measure has left my brain. So Kelly or Robin, if you all happen to remember that one, please feel free to chime in. But there are right now 3 public health or population health, really, claims-based measures that are typically looked at the group level for the most part. I can't remember if that third one, though, is drilled down to that individual provider, but that's something I can get you some more information on and get that to you, though. Sorry, it's left my brain.
Well, it's left mine too, because I read that as public health and it probably should have said population health measures. Oh, another question about the slides available and the recording. So the recording will be sent out to attendees probably within the next couple weeks. So those who have participated today will receive a copy of the recording. And then, so we mentioned earlier about KHI funding, and so someone's asking about the deadline for applying for KHI funding is May 1st, but they're really specifically wanting to know, when do they have to have it implemented by? Is there, I guess they're referring to, if we apply for funding for one of those two public health measures, do we have to have this in place by a certain date?
And yet, so that one, you don't have to actually have it fully in place and functional, but you have to be starting. You have to have started that initial process by then. You have to have proof that you've that you're working with your vendor, that you're working on that build in order to be able to continue to move forward with that funding.
Yeah, I agree. You need to have your addendums in place because with KHI and your vendor, and start showing some documentation there. Okay, looks like, so we have a question about the SAFER guides. And so we talk about SAFER, but it being an acronym, but I don't think we described how it was actually what it stood for. But the question is do we have to answer yes for all of those requirements?
So actually you don't. You can say yes or no to the SAFER guides. During the attestation piece, it's going to ask you whether or not you've completed the SAFER assessment. There is a link to the process. CMS actually provides the tool to perform the SAFER assessment. It's quite lengthy, and it's something that we can definitely send to you as well. But it's not a must-pass measure, at least for 2022. From my understanding and from the way the final rule is written, it sounds like it's going to move forward to become a required measure. But for this year, they've introduced it. They've made it a mandatory measure where you have to report on it, either yes or no, but you don't have to report yes.
Also, Kelly, just back on that too, if you go to the healthit.gov website and you do a search for SAFER guides, you'll be able to go to a page that will give you all sorts of information about the SAFER guides if you want to dig into that as well. I know we had a question about trying to find some more information on the details around it.
Yeah, it looks like there was a question that came in wanting to know where they can find it. I think Kelly, you mentioned, or Jessica, one of you mentioned healthit.gov. That's where you can find the SRA that you can complete in-house. And I think the SAFER guides are actually listed there as well. It's been a little bit since I've looked at those myself, so I believe that's where they are.
Actually drop in the chat or the Q&A so that everybody can see that.
Yes. All right. So if you didn't hear Jessica, she's dropped the link for the SAFER guides in the Q&A. If you all that are still on with this want to go in there and pull that down, we'll leave that up for just a little bit. Okay, it looks like I don't see any more questions, but I want to double check real quickly.
Hey, Robin, this is Vance.
Hey, Vance.
To chime in on the question about the public health funding opportunities with KHI. I spoke to, it's my understanding from conversations with KHI back in December that if you apply for that, that deadline is the May 1st deadline, but it needs to be started and start that implementation and the agreements be signed at least by June of this year. That's the way I understand KHI to have said that for those funding opportunities. Just so for some more clarification on that.
Thanks, Vance. And I'm glad you chimed in with us today.
You're welcome. I appreciate all y'all's info today.
Okay, I do not see any additional questions coming in on the Q&A. So we want to thank you so much for joining us today. If you have any questions following our webinar, you can use any one of these methods to contact us. If you have anything else, we will reach out to you after the webinar and follow up with you so that we can answer any late incoming questions. So with that, thank you all and have a great day.